Hi everybody, it's Andrea back again, and now we're going to have a look at the hand hygiene. So as we're all very aware, clean hands save lives. So why do we need to perform hand hygiene? Why is it so important? So Ethan has already gone through earlier the chain of infection. So the idea is that we need to be able to break that chain of infection, and the most effective way of doing it is the means of transmission. So if we are cleaning our hands, we're breaking that chain at the means of transmission. So when do we need to clean our hands? So we clean our hands in accordance with my 5 moments of hand hygiene as per the World Health Organization. So before we would ever touch a resident, we should be cleaning our hands. Why? Because our hands could be carrying infectious agents or organisms, and we could pass them on to the resident. Before we would do a clean or an aseptic procedure, such as wound care, after we have touched a resident, because we may have picked up an infectious agent or organism from the resident onto our hands, and we don't want to be that means of transmission. After touching a resident's surroundings, we would always clean our hands. So things like beds, bed rails, bedside lockers and bedside tables, because they could have been contaminated, and particularly with COVID-19 you can have droplets on those pieces of equipment, and as a result we could accidentally contaminate our hands. So we need to clean our hands after touching a resident's surroundings. And finally, we would clean our hands after we have been exposed to bodily fluids, so an unclean procedure such as hygiene needs after elimination. And in actual fact, when we look at cleaning our hands after an unclean procedure, it's very important to recognise that we may need to, if we have assisted a resident with personal hygiene after elimination, and then we're going to move on to a clean procedure such as placing oxygen on a resident or making their bed, we need to take off our gloves and we need to clean our hands, and then we need to put on a new pair of gloves. So if you're moving from an unclean procedure into a clean procedure, you need to clean your hands and you need to put on a fresh pair of gloves. The gloves are single use only, so we would only ever use them for one particular task. And it's also very important to recognise that wearing gloves does not substitute hand hygiene. Every time you remove your gloves, you must clean your hands. So, when do we wash our hands with soap and water, and when do we use alcohol rub or gel? In actual fact, according to the World Health Organization, alcohol-based hand rubs or gels are considered to fulfill the highest standard of safety in relation to prevention of cross-infection. The reason for this is when you clean your hands with soap and water, you are cleaning your hands. When you use alcohol rub or gel, you're actually disinfecting your hands, so you are giving a higher level of cleaning. Not only that, but we find that using alcohol gel or rub can be more ergonomically friendly. In other words, it can be at that point of care. So you can have an alcohol rub or gel in the resident's bedroom or on your person. And it is far more quicker and efficient to use, because if I go to the sink to wash my hands with soap and water, I need additional time as well as 30 seconds to carry out the hand hygiene technique. I also need time for turning on and off taps, for drying my hands effectively, and for disposing of that paper towel. Not only that, I am at the sink, and therefore I cannot move from it whilst I'm cleaning my hands with soap and water. Whereas you'll find when you're using the alcohol rub or gel, you don't need any time for turning on and off taps, for drying of hands or disposing of paper towel, and you can actually clean your hands whilst on the move. You're not stuck in one point. And in actual fact, research also has shown that our skin better tolerates alcohol rub or gel rather than soap and water. I would like to emphasise at this point the importance of looking after your skin and to moisturise your skin whenever you do get a chance. So we can use alcohol rubber gel whenever our hands are visibly clean. If your hands are soiled, then you must use soap and water. But if your hands are visibly clean, you can continue to use your alcohol rubber gel. And how long can you use it for? Well, that does depend on manufacturer's instructions, but if your hands are visibly clean, you can use it. Staff will say that sometimes they can get a build-up of layers of alcohol rubber gel and they would prefer to go back to the sink and use soap and water to remove those layers, and that's absolutely fine. Not relevant for COVID-19, but just to point out to you that alcohol rubber gel does not kill Clostridium difficile or norovirus, the winter vomiting bug, as infectious agents. In those circumstances, you must always use soap and water. So using alcohol rubber gel literally only takes you 30 seconds to complete. It is quick, easy, and it gives you the highest level of disinfection. So we can clearly see here that the most commonly reached areas when we're doing our hand hygiene are there in white. The frequently missed areas that we're seeing are highlighted in blue, and then finally the most frequently missed areas of the hands are in red. So when we can clearly see the tips of the fingers, in between the fingers or the finger webs, the thumbs, and then just below the hands around the wrist area. And in actual fact, I always think that if you remember those areas when you go to clean your hands, it does certainly help in relation to remember to get those areas and concentrate your technique in those areas. So they're the tips of the fingers, in between the fingers, the thumbs, and below the hands at the wrist area. You can see here a poster. There's many different types of hand hygiene posters available, and it is always recommended that a hand hygiene poster be available to staff at your hand hygiene points. So that will be the alcohol hand rub techniques where you have alcohol dispensers, and then the soap and water hand washing technique at your sinks. And it allows for a visual prompt for staff to be able to see how to carry out their hand hygiene technique. So just to recap, clean hands save lives. Remember to clean your hands in accordance with my 5 moments. So that is before touching a resident, after touching a resident, after touching a resident's surroundings, before a clean procedure, and after an unclean procedure where you've been in contact with bodily fluids. If in doubt, clean your hands. And when you're cleaning your hands, don't forget the most frequently missed areas: tips of fingers, in between the webs, the thumbs, and just below the hands at the wrist. And always use your soap and water for Clostridium difficile and norovirus infections. So now what we're going to do is have a look at a practical session where I'm going to demonstrate the correct hand hygiene technique, and then I'm going to get you to follow that with me once I have demonstrated it.